So I'm Dr. Natasha Fothergill-Misbah. I'm a researcher at Newcastle University in the Population Health Sciences Institute, and my work focuses on Parkinson's disease in Africa. There are multiple challenges associated with Parkinson's disease in the context of Africa, so including access to diagnosis, treatment, care, stigma, among others. And so this project really tries to tackle those multiple complex challenges by work on the ground with people with Parkinson's disease and using their voice and their lived experience to raise awareness about the challenges. So people living with Parkinson's disease and their families really struggle in the context of Africa, so not just in Tanzania where the film was made, but across the continent. And so if we can raise awareness and impact policy and care, we can try to improve the lives of people living with Parkinson's and their families in these places.
We conducted a study 20 years ago in Tanzania, and we looked to find people with Parkinson's in a community. The majority of the patients that we found had never heard of Parkinson's disease, never mind knew they had it. So I think in Africa as a whole, there is probably a very large iceberg in the fact that the people who end up being diagnosed are the minority and the majority are never aware of it.
So the project took place within the context of the Transforming Parkinson's Care in Africa grant. So we received additional funding to do some engagement work in Tanzania, so one of the countries that are involved in the TraPCAf project. So this engagement work was funded by the International Science Partnerships Fund through Newcastle University to make a film about the challenges of living with Parkinson's in Tanzania, to set up a support group for people living with Parkinson's, as well as host a workshop to address stigma in the community with policymakers and local health and service providers. So people with Parkinson's and their families were the main target for the outputs of this project. In making the film, we hope that we've raised awareness about Parkinson's disease in the community. We wanted to make the film in Swahili so that people with Parkinson's could tell their stories in their own voices and in their own language. And the 3-minute explainer video is also in Swahili, and so that our hope is that that will kind of spread through Tanzania and raise the awareness of Parkinson's disease. The support groups are designed to help people with Parkinson's learn more about how to manage their condition. It's a really complex condition, and the kind of management of Parkinson's from the health system is not as robust as it could be. So the support groups play a really important role in enabling that access to information and support, and legitimacy as well, where people with Parkinson's can see somebody else with the condition and know that they're not alone, and get that support from each other.
We have definitely managed to raise the profile of Parkinson's in Africa through this project. Many people have heard about it. For example, we are linking with funding to look at the genetics of Parkinson's in Africa, and there is more genetic variation there than the rest of the world put together. We will definitely discover new things that haven't been discovered elsewhere in the world. And that has an impact not only for people in Africa, but also for people with Parkinson's worldwide. It may actually pave the way to new treatments potentially.
Engagement is a huge part of the work that we do. We really want people with lived experience to be part of the process of the research. So we want them to drive the research ideas, the research methods, the dissemination. But we also are aware that we can't just do research in a population and not engage and interact with the wider community. This kind of artistic way of getting those messages across. It's demonstrated the need for this kind of engagement and dissemination rather than just the academic publishing or policy reports. And so hopefully we'll be able to get more funding to make future films as well, which will ensure that we have the maximum impact from the work that we do. I think the success of this project is a shining example of the benefits of community engagement in the context of global health research. Global health research funding is being threatened by cuts to ODA funding, and I think now is the time to really take a stand and think about what impact that will have on communities in the long term. So our project won the Engaging for Health and Wellbeing Award in this year's Engagement in Place Awards, and it was a real honour to win this award this year. I think demonstrates the impact of the engagement work that we've been doing, and it's really nice to know that Newcastle University value the global health research that we're doing and the really strong relationships that we've built with partners on the ground and the collaboration and efforts that we've gone through to make the film and the engagement work.